Thyroid problems are often blamed for excess weight gain. But how much does this gland actually contribute? Obesity specialist and endocrinologist Dr. Minisha Sood talks about exactly what the thyroid does and how it's connected to weight gain. Many people who are gaining weight and not understanding why they're gaining weight attribute it to a thyroid problem.
That's a very common connection that people make, and sometimes it's true. Sometimes someone's thyroid gland is not making enough thyroid hormone, which then can lead to weight gain, but there are many other symptoms that could be coming from underactive thyroid, and we have to keep in mind that we're looking for maybe just more than one symptom.
And how does the thyroid hormone affect obesity? Why do you gain weight if you have low thyroid?
So thyroid hormone is classically associated with metabolism. It does so much more than that. It regulates our heart function and our bowel function. It regulates how we manage water in our bodies. So typically a lot of the weight gain in hypothyroidism or underactive thyroid is due to excess water weight. Sometimes it can be due to excess fat mass, and I think that really occurs also when people feel depressed because of underactive thyroid, and maybe that leads to changes in eating behavior or physical activity because they're feeling tired. So sometimes it can be more than just not making enough thyroid hormone, but everything that comes downstream of that.
If you think that the reason you're gaining weight is due to your thyroid, where do you start? Do you see an internal medicine doctor, or do you go to a specialist? And what tests would be done?
An internal medicine doctor is a perfect place to start. They can check a TSH, or thyroid stimulating hormone, and that's really the most sensitive indicator as to whether someone's thyroid is working properly in most cases.
If you do find out you do have a thyroid problem, if you treat it, will it help your obesity?
If that was the cause for the weight gain, then treating the thyroid condition should improve the excess body weight. In my experience, however, sometimes that doesn't accomplish the whole goal. There has to be change in lifestyle and exercise, and it's kind of a slow process. I would really encourage patients to go beyond thinking that it's just a thyroid problem or that the tests aren't right or accurate, because our tests are very good. So it's important to consider all possible causes of weight gain.
While the thyroid may be connected with obesity and being overweight, it's important to talk to your doctor to understand all the factors that may be contributing to your weight gain.